So this is a video about LASEC and LA clot, the subtle difference between the two. And this image I have already published. So what you are seeing here is a kind of a layered clot, probably with a cavity in the middle of the clot occupying the left atrial appendage. This patient had probably normal sinus rhythm, and what you can see, the LA is dilated, the intra-atrial septum is free, so probably could not be a myxoma. The pulmonary vein orifices look okay, but in short axis, the mitral valve orifice is stenotic. There is calcification of the tips of the AML and PML. The left atrium is very much dilated, and on color Doppler, we established a diagnosis of severe mitral stenosis. The aortic valve seemed normal. So this clot formation is more posterior. We found it a bit difficult to bring it into view because it was a bit posterior, was occupying the LA appendage and the roof of the LA. Because it was a mitral stenosis, severe mitral stenosis, we know there is stasis of blood within the left atrium, and in association with atrial fibrillation, there is always a predisposition for clot formation in the left atrium. Having said that, the other prerequisite for clot formation within the left atrium is that there should be change in the cellular component of the blood, and also there should be change in the endothelium of the left atrium, the evidence for which is not clear. Now, this is a case of swirling of blood within the left atrium. This is the ultrasonic reflection of aggregates of blood within the left atrium, probably red cell aggregates and fibrinogen, seen in patients only with severe mitral stenosis. And here the velocity is low because of mitral stenosis, and hence you are seeing this LASEC. The left atrial appendage is free, this swirling of blood within the left atrium. And you don't see this in patients with severe mitral regurgitation because the velocity of blood is quite high. So one of the predisposing factors for LASEC is low velocity, stasis, irrespective of the rhythm, either in normal sinus rhythm. If the LV function is very poor, you still can see LASEC, and in atrial fibrillation, you tend to see this aggregation of red cellular components in association with fibrinogen, because in these patients with severe MS, there is increased fibrinogen, which tends to bind with negatively charged red cells, and that's what the literature says is the cause for this ultrasonic reflection of blood seen as swirling of blood or left atrial spontaneous echocontrast. And this does not get resolved by antiplatelets or anticoagulation. One has to relieve the stasis. And in this bicaval view, you can still see the intra-atrial septum is very clean, and naturally it is a case of dilated LA with stasis and low velocity situation. So after the valve is replaced in this situation, in mitral stenosis with good ejection fraction irrespective of the rhythm, once the valve is replaced, as you can see here, you can see it's a bioprosthetic valve with the struts. So once the valve is replaced, the left atrium appears to be very clean. So one of the most important predisposing factors, if one can see the workhorse triad, is stasis. So once you relieve the stasis, the LASEC is gone, which is an important predisposing factor for thromboembolic events in severe mitral stenosis. Thanks for watching.